Hi, this is Dr. Hud Shaker, cancer surgeon and health coach. Today I want to talk about calcium supplementation, why it matters, especially for women who've completed treatment for early breast cancer, and how to make sure you're getting the most from it. I'll cover how calcium supports bone health, its wider role in overall survival in non-cancer health and cancer health, and I'll give you 3 tips on how to maximize your calcium intake and absorption. So why is calcium so important after breast cancer? Well, after treatment, keeping your bones strong becomes essential. Hormonal therapies like tamoxifen or aromatase inhibitors like anastrozole or letrozole often reduce bone density and increase the risk of osteoporosis. On top of that, many treatments worsen menopausal symptoms like chemotherapy, for example, and menopause itself is a risk factor for osteoporosis. Calcium is crucial here. It helps build and maintain bone strength, and the evidence backs this up. A BMJ, British Medical Journal meta-analysis showed that calcium supplements, especially combined with vitamin D, reduce fractures in women over 50. But there's more to calcium than just bones. A 2012 study in the American Journal of Clinical Nutrition found that postmenopausal women who met their recommended daily calcium intake had a 10 to 15% lower risk of death from any cause. Why is this? It's likely because calcium also supports heart health and muscle function. There's even data from the Journal of Clinical Oncology in 2014 showing that improved survival in colorectal cancer patients with higher calcium intake. Again, this may be because it impacts cancer-related survival or overall survival, or both. But either way, we know it's beneficial. So how can you make sure your body actually gets enough calcium? I'm going to give you 3 tips on maximizing your calcium intake and absorption. Number 1 is pick the right calcium-rich foods. Forget the endless lists online. Choose foods that you actually enjoy and or ones that your body can actually absorb well. The first food on my list is oily fish, like sardines or anchovies. Eat the bones for maximum calcium absorption. Number 2 is yogurt, especially cultured ones like kefir, which provide you the calcium but also support your gut health. And thirdly, almonds and seeds, easy healthy snacks with a calcium boost that also contain some healthy fats. The second tip is to add vitamin D. So as well as adding calcium supplements and also getting them from natural sources, you want to add vitamin D supplementation because it helps with the absorption from the gut. And this is particularly key in the winter months when you don't have the added benefit of the sunlight, which helps with vitamin D metabolism in your skin. And number 3, cut back on alcohol. Alcohol interferes with calcium absorption. Cutting out will help with improving calcium absorption, and also you have the wider benefits of alcohol reduction, which we know are key in breast cancer. Let me know what you think about these tips. Let me know what you're doing to optimize your calcium absorption to help after breast cancer treatment.